Funding for the special health series, Watch Your Mouth, comes from the Dr. Donald Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Mount Sinai Healthcare Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, St. Luke's Foundation, the Sisters of Charity Foundation of Cleveland, the Woodruff Foundation, the Kaiser Foundation Health Plan of Ohio, and the United Black Fund of Greater Cleveland, Incorporated.
Going to the dentist for me is a nightmare.
Fear and cost keep millions from getting dental care. But a healthy mouth is about more than just teeth.
Your oral health has a lot to do with your overall body.
In the next half hour, discover the connection between gum disease and heart disease, diabetes, even premature birth. Now heed the warning and watch your mouth.
Let's take a look here.
Every year, millions of Americans delay or avoid trips to the dentist due to anxiety or fear.
We understand that as dental professionals, that we're one of the top fears of people. I think they fear, of course, the needle, and they fear pain. I think they fear the unknown, too.
The metal drill on my teeth, hitting a nerve, just sends chills through my body.
As a marketing manager at the Lu Jing Fang Clinic Health and Wellness Center, Jamie Francis values a nice smile. But years of avoiding the dentist due to fear have taken a toll. Francis has one tooth that's broken off due to decay. Another is cracked and black. Now she's about to embark on the unthinkable, a trip to the dentist.
About an hour ago I was sweating, getting a little bit frantic, just thinking about it. So it's time to go.
The more you dwell on it, the more anxious you get. So it's certainly true with the dental office. So the staff knows when Jamie comes in, we bring her right back and we get her seated and make sure that she's okay.
Dr. Steve Marsh sits down with Francis to discuss the treatment plan. They agree to remove the decay from the tooth on the left that's cracked and rebuild it. Experts say open and honest communication between dentist and patient is the #1 tool to fight anxiety. These days, dental schools spend lots of time teaching communication skills.
One of the best techniques that we teach our students is the show, tell, do. Speaking to the patient during the procedure helps to give the patient a feeling of control because they know what's coming.
So I'm going to start with some topical anesthetic, and the topical numbs up the tissue so that when I give you the injection it feels nice and easy for you. So what I'll do is I'll go in for about 1 or 2 seconds. Okay, so if you'll open for me and turn to Marilyn ever so slightly. Here are the 1 and 2 seconds. 1, 2, and now I'm out. So hopefully you've barely felt it at all. And if at any time while I'm working you have any sensitivity or any problem, you'll let me know and I'll stop right away. Would you like to have earphones so you don't hear the drill, or?
Francis opts to listen to music on her iPhone. Dentists offer a variety of things to distract anxious patients.
There you go.
So-called spa dentistry includes dim lighting, massage chairs, even aromatherapy.
Studies have clearly shown that there are certain aromas that do reduce patients' anxiety and therefore can reduce their fear. And we know that a patient who is more anxious is more likely to perceive pain or think that they feel pain. The use of the laughing gas, which is nitrous oxide, or even given Valium, we find that we have to do less and less of that since we're using these other stress-reducing procedures.
Jamie Francis opted to go through her procedure without Valium. Dr. Marsh uses a topical numbing anesthetic and 2 separate injections of Novocaine. The first numbs the injection site, the second numbs the tooth. And because Dr. Marsh is working near the nerve, he coats it with an insulating medicine.
And we're in pretty great shape right now.
With the decay gone, it's time to rebuild.
When you're rebuilding a tooth the way we are with Jamie, you have to put a band around it. That becomes my frame. Then we actually injected this composite into it. The light actually bonds the material. There's a hardener that gets activated by light. So now, Jamie, I'm going to take off this band Hopefully it slides out easy. Sometimes it does, and there it is. And now you've got a tooth back.
With some sculpting, contouring, and polishing, Dr. Marsh is done.
No, it did not hurt at all. I didn't have any pain. I can actually smile again. And I don't have to be embarrassed about smiling for a picture.
Jamie Francis has a restored tooth and a new attitude about her next trip to the dentist.
If I had only gotten past that fear at a much younger age, it could have been very simple. Thank you so much, Dr. Marsh.
I tell you, it was my pleasure. You're always a joy. No, and I mean it. You're very kind.
Two of the most common reasons people go to the dentist are for cavities and root canals. So what exactly happens? Let's take a look.
Hi, Jenna.
Hi.
Nice to see you. How are you doing?
I'm good.
Dr. John Kinsley is preparing to fill a cavity for 15-year-old Jenna Inks.
Cavities vary in size from near undetectable, small, medium, large, where it can encompass literally the whole tooth. And it rots the tooth and decomposes the tooth.
The process of decay begins with eating. All the drinks and food we consume coat our teeth with plaque, which you may not realize is mostly live bacteria. Failure to remove it with regular brushing and flossing causes a buildup. Sugary and starchy substances are particularly harmful because they allow certain bacteria dentists call the sugar bugs to thrive.
And these bugs have the ability to process that sucrose into long chains that create these matrices that they colonize and live on. And they start to build a biofilm on the tooth. And then they process the sugar further and they produce lactic acid. And that lactic acid stays there and starts destroying the enamel.
Once acid eats through the enamel, decay penetrates into the softer layer of the tooth, forming a hole or cavity.
It's almost like a pothole. So a cavity is at the pothole, and we're going to try to resurface it and restore it back to its original shape. How's the numbness now? How do you feel?
Pretty numb.
Pretty numb. Where
Dr. Kinsley begins by using a drill to remove the decay. A digital reader indicates if he dug deep enough.
So there's the cavity right there, where it's white.
Next, Dr. Kinsley uses a special dye to make sure all the decay is gone.
We're going to stain it with a dye, okay? And this is a cavity stain. How you holding up?
I'm good.
Now it's time to fill the hole. In the past, doctors used mostly silver fillings. But with public concern about mercury in silver fillings, and with the development of newer materials, many dentists now use composite resin, comprised of tooth-colored plastic and glass.
It's plastic that we can form, shape, sculpt, and within about a minute it's rock hard and it's very strong and it bonds to the tooth.
The bonding with composites means dentists have to take out less of the tooth. Composites are, however, more expensive than silver fillings. But for Jenna Inks, they do the trick.
Good thing we got that, huh? Hi, Dan.
Hi.
How are you? Good. How are you doing today?
Dan Jones is about to go through a more extensive and dreaded procedure. Each year, dentists perform about 15 million root canals.
A dental root canal is a procedure that we do to treat a tooth that has become infected either by decay, by trauma from maybe a fall or an injury or a blow to the mouth.
Let's say a cavity is not caught in time. The decay continues into the innermost chamber of the tooth, known as the pulp, which contains the nerves. Once the pulp becomes infected, an abscess forms at the tip, damaging the bone and causing considerable pain.
It's almost like the tooth constantly getting pounded on. It's bruised, it's inflamed, it hurts now, and it's irreversible.
In order to save the tooth, the chamber and its canals must be cleaned out, filled with a cement and rubber-like material, and sealed off.
Can you feel some of the anesthetic already starting to kick in? Okay. Where are you feeling it right now?
My left leg.
Your left leg there, okay.
Dr. Kinsley first numbs the affected area with Novocaine so he can drill deep into the tooth. He irrigates the canals, then uses a camera probe in the mouth to make sure the space is clear of bacteria before sealing it off. Many root canals require multiple visits so that a crown, also known as a cap, made of gold, other metals, or porcelain, can be placed over the damaged tooth to restore it.
Okay, Dan, now the root canal is completely sealed up.
Cavities in root canals are but two of the consequences of sugar bugs and plaque that live on teeth. Now, as we continue to track the plaque, you're about to see how dangerous bacteria living in the mouth can affect more than just the teeth. Consider this shocking fact. The human mouth can contain up to 700 different kinds of bacteria.
50% of the number of bacteria present in the body is present in the mouth.
Good bacteria in the mouth do things like heal wounds. The bad kind live in plaque that can harden into tartar, harming our teeth and our gums. To demonstrate, Dr. Nabil Basada removes a piece of plaque from my mouth.
I'm going to take it here and I put it on this slide. This is a very small amount of plaque, and then we are going to put it under the microscope, just a higher power, to see what is in it.
Under the microscope, we see different shaped creatures squirming and crawling. Keep in mind, such creatures live in all our mouths, but in my mouth, some bad ones have overtaken the good.
Well, the long filament one is like a worm. It looks like a wiggly worm.
Exactly like a worm.
That's the bad kind.
That's bad.
How afraid should I be that all that's in my mouth, alive, swimming?
Well, it's not a good thing to have that stuff in the mouth, because you put yourself at a risk. You don't need that.
Those bad bacteria can be the start of gingivitis, the earliest stage of gum disease in which gums appear red, swollen, and bleed easily.
As we go around the tooth, I want to make sure that we're within that green band.
To check for gum disease, doctors use a ruler instrument. As pockets of inflammation get bigger, so does the space between the teeth and gums.
So I'm down into about 4 millimeters here. And that's starting to get what we would call a pocket.
The bad bacteria is underneath those
Yeah, the bacteria
parts?
starts on the tooth surface, and then the bacteria starts to creep to reach under the gum.
Here's what advanced gum disease looks like. If the infection reaches the jawbone, the teeth can fall out. Gum disease now surpasses decay as the #1 cause of tooth loss among adults. The bacteria that causes it can wreak havoc in other parts of the body as well. For years, doctors have known that bleeding gums can allow bad bacteria to get into the bloodstream and cause infections. That's why people with certain prosthetic devices, like heart valves or replacement knees, have to take antibiotics before having dental work. The danger of traveling bacteria is also why people slated for major surgery, like heart bypass, must first take care of all their dental problems.
Here, have a look, please.
But recent research conducted here at Case Western Reserve University School of Dental Medicine now shows that chronic inflammation associated with gum disease is another source of trouble.
So gum disease equals inflammation, and inflammation spells trouble for the rest of the body.
Toxins associated with inflammation contribute to the formation of clots that can lead to heart attacks and strokes, so-called hardening of the arteries. Having gum disease puts you at a substantially higher risk for having heart disease. Dr. Basada thinks it may even trump high cholesterol.
In my experience, that inflammation coming from periodontal or gum disease is of more significance or plays more of a role in heart attacks or heart disease than high cholesterol level.
70-year-old Donald Nemeth has both gum and heart disease.
What amazes me is that the plaque buildup in your teeth can affect your body health to to degrees I never could imagine.
Here's another example. It's long been known that poorly managed diabetes increases the risk of having gum disease. Now new research shows the relationship is a two-way street. Diabetics who take good care of their gums may have an easier time managing their diabetes.
If you treat gum disease, your blood sugar level becoming lower too.
I doubt that hardly anyone knows that doing good dental care is going to help you with diabetes.
There is evidence, too, that gum disease can also play a role in some cases of premature delivery or stillbirth. Dr. Raymond Redline is one of the few placenta pathologists in the world. He examines the tissue samples taken from the placentas, which are the afterbirths from mothers who give birth to premature or stillborn babies. Stand by, because now we're going into the pathology lab. Be advised, some of the footage gets a little graphic.
When you break your bag of waters, this is the bag of waters.
This bag holds the amniotic fluid, which together with the placenta nourish the growing fetus and act as a protective barrier. A barrier that in a few cases, oral bacteria has now been found to infiltrate. You have been able to find that the oral bacteria from the mouth crossed in through that bag of membranes? That's where they cross?
That's right. They can either cross the placenta itself and go directly into the baby, or they can go into the bag of membranes and cause an infection that triggers labor and leads to preterm delivery.
Proof of such transmission came from the work of Dr. Yiping Han, who developed a special DNA test to show that bacteria taken from the mouth of a mother who delivered a stillborn match the bacteria found in the placenta.
What we showed was really the first case in the live human being that this really can happen. And so it's a proof of concept, and it's really a very important step in our pursuit.
Bleeding gums, so-called pregnancy gingivitis, is common. And contrary to the old wise tale that pregnant women should stay away from the dentist, expectant mothers, just like everyone else, need regular dental care and need to brush and floss. In the future, as more research is conducted, there may be more specialized interventions designed for pregnant women in gum care.
Well, I think it's early in the game, and I think as we accumulate more data on what that oral microenvironment in the mouth becomes during pregnancy, we'll be able to more specifically target either organisms or the care that we provide to change that.
As evidence mounts about how gum disease may place people at greater risk for costly oral and other health problems, the call for public awareness and good prevention efforts gets louder.
What we need, very importantly, to convey to the public is that behind that smile, we have to have a healthy mouth. And it's the health of the mouth that we feel is extremely important in contributing to the health of the body.
Okay, what's your first and last name? Jacqueline.
Jacqueline Matthews feels lucky to be getting expensive dental work done at a reduced rate by local dental students. Matthews recently lost 3 teeth to gum disease.
I was very shocked to learn that I was going to lose some teeth, considering the fact that I was a regular person to go to the dentist regularly.
Matthews was even more surprised at the price her private dentist quoted for replacements.
He was talking about, maybe $15,000, $20,000. And I don't know about you, but that amount of money for that type of work just doesn't fit in our budget.
Matthews is the wife of C.J. Matthews, pastor of one of the largest churches in Cleveland. When they took over the ministry, the couple left full-time jobs with benefits. Now they pay for health insurance themselves. And like most people without employer-based coverage, they decided to drop their dental plan.
When we waited this last time to look at what we pay out of pocket versus the premium, it made no sense to pay the premium. For us.
Can you go ahead and open and close?
The kind of work Jacqueline Matthews needs is out of reach for many Americans these days, whether or not they have insurance. That's because most dental plans are designed to cover relatively inexpensive preventative procedures, but max out or have tight restrictions on major restorative dentistry.
Preventative services are always covered 100%. It doesn't matter what plan it is. It's usually 100%. That would be your exams, your cleanings, your x-rays, and that type of thing. What they start to limit is things beyond those services, things like crowns and implants and bridges and things that replace teeth and give you better function.
Given the current system, experts say the best thing anyone can do is try and prevent expensive problems from happening in the first place. That starts with regular visits to the dentist for checkups and cleanings. And the cheapest and most effective action that virtually everyone knows is brush and floss. But not everyone stops to think about exactly why doing both is so important.
So pull the floss like this, slide up and down, scoot over this way, make it a C shape also, and again.
While brushing removes bacteria on the front of the teeth, flossing is needed to get rid of it on the sides before it hardens and turns into tartar. Failure to brush and floss puts you at an increased risk for gum disease. So does smoking or having a family history of gum disease. Once gum disease develops, it's too late for prevention and time for treatments. Deep cleanings known as scaling and root planing. Dentists use special instruments to remove plaque and tartar on the tooth's surface all the way to the bottom of those pockets of inflammation. Sometimes a local anesthetic is used.
The gum is a little bit loose. It's called a pocket. So that it goes down into that cavity. And if you push it down hard at the bottom, it hurts.
More drastic measures to treat advanced gum disease involve gum surgery.
Do you see how in the back here where the gum tissue kind of came up over the tooth? That's an area.
Another preventative action dentists can take involves sealants, coating the grooves of a tooth with a chemical compound to prevent cavities.
We put a primer on the tooth and then we flow this plastic-like liquid, and within a minute it's hard and it protects the tooth and it prevents bacteria from getting stuck in those grooves.
If you still think flossing and other prevention methods aren't vital for healthy teeth and your pocketbook, take another look at the bacteria Dr. Basada found living on my teeth.
People don't believe until they see that. And this is a very good incentive for the individual to take care of his own mouth.
So we want to have you come across and do all the surfaces of the teeth. The cheek side, the tongue side, and then the biting side, okay?
Experts say prevention needs to start early by teaching children just how important the health of the mouth really is.
Your oral health has a lot to do with your overall body. And for a long period of time, and during my career, it's been one of those things where it's finally people are starting to figure out, hey, your mouth is part of your body.
I think it's as important to keep your mouth healthy as it is to keep your heart healthy.
Well, I think as we're going through healthcare reform, the discussion of dental does not need to be left out, because oral hygiene and dental health is so significant to your overall health that it's unfortunate that many people probably, given the set of circumstances with healthcare as well as dental premiums and what they cover and don't cover, probably aren't getting the proper care.
To experts, the bottom line is clear.
Watch your mouth. Watch your mouth.
Be sure to visit our special Watch Your Mouth website, where you can watch, listen, and link to relevant information and valuable resources. Go to health.wviz.org. You'll find web-exclusive stories about groundbreaking dental research being done right here in Northeast Ohio. You will also find links to local, regional, and national resources, plus multiple opportunities for your input and feedback. Go to health.wviz.org. Funding for the special health series Watch Your Mouth comes from the Dr. Donald Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Mount Sinai Healthcare Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, St. Luke's Foundation, the Sisters of Charity Foundation of Cleveland, the Woodruff Foundation, the Kaiser Foundation Health Plan of Ohio, and the United Black Fund of Greater Cleveland, Incorporated.